When we were planning the renovation, we had the patient in mind. So we wanted to make sure that the environment was as comfortable as possible. We were thinking about home. We were actually thinking about bed and breakfasts.
I didn't want a place that was going to be overly crowded or really, really busy. And so it felt like it was quiet, it was peaceful.
We're really about this experience that mothers and fathers and families will have while they're here.
This is kind of a typical environment when you come in. They're all single rooms, all single bathrooms.
All the nurses here, all the docs, the midwives, everyone is great. From a nursing perspective as well, you know, I feel like everybody here enjoys what they're doing. We give women a lot of choices.
The goal was to go all natural, but more than anything, just, I guess, having people who would support whatever decision I was going to make.
We're all about choice, so when a mother's trying to decide on the type of delivery she wants, we feel really confident that we can offer her the full spectrum.
I wanted to go in the shower for a while, I wanted to get in the tub for a while, and so everything that I wanted to do, there was always someone there assisting me with it.
Hydrotherapy is a well-respected, well-established form of non-medication therapy, and we have a birthing tub where they can labor, and they can just labor in the tub and get out to birth if they'd like, or they can labor and birth in the tub.
We have labor, delivery, recovery, postpartum all together, which I love. The room you come in is the room you'll stay in for your whole visit.
Their environment becomes a part of their experience, and it's important for that to be a continuum and not broken up.
It's all designed for that purpose, to make that one room serviceable for the entire experience.
Their labor and their delivery and meeting their new baby is a continuum. Why shouldn't the environment that's enclosing that event?
When Sage was born, he was pressed onto Jasmine and they left her alone. Like, I thought, oh, they're gonna take him away and they're gonna do stuff to him and he's gonna be gone for a while, but we had a lot of time.
It wasn't overwhelming. It felt like not necessarily I'm in my own home, but I'm in my own place of just me and my husband and my child.
I just heard great things, so I wanted to try it. I came for a tour, brought my daughter, and just loved the look, and the nurses seem really great.
All women should be able to feel like they could come here and have as much as possible the delivery of their choice.
I definitely feel, being my fourth child, and it's been 11 years, that this pregnancy, being a little older, I've been a little more high risk. So I've been watched a little more closely, and they just are great when I come in here. I come in and get monitored and checked out, and it's just been a good experience.
All right, so we'll see you next week.
Thank you very much.
Bye, Heather. 95% of pregnancies in labor and delivery are normal. They're going to come to fruition and birth with no problems. A lot of babies that are delivered in Boston then come back here to finish out their higher level of care that they need beyond normal newborn nurseries. So we have a neonatologist, and she's always available to us for consultations. She meets with patients.
In those situations, you know, when we need to intervene and do things, they get done. And I'm on both sides of that as well. I've been one of those people that have needed intervention with one of my babies, and they're phenomenal.
We have an operating room, I think it's 15 feet away. We use it when we need to, and I think you can be more flexible with a patient's plan, knowing how quickly we can intervene if we need to.
They can have all three tiers of care. They can have a midwife, an obstetrician, and a maternal fetal medicine person involved in their care and deliver here.
When I imagined taking this job and just being a laborist, That was one of the things that was attractive to me, and I think attractive to the patients, to know that there's someone standing by who is an expert in those things, but doesn't really want to use them unless the situation calls for it.
Every birth is amazing, and I especially enjoy teaching parents. I enjoy being a part of this experience for them, letting them come here and having us be a part of their experience is really great. It's a phenomenal feeling.
They even made sure that we got to try out some of the things, like taking care of his circumcision, changing his diaper, doing swaddling, and all the techniques that we should be able to practice while here so that we can go home and feel prepared.
I feel like I know what I should know. I know I have questions and I know I can call them, but they've definitely been here to let me know how to take care of everything.
Patients today are doing a ton of research. So when they choose to deliver at the BirthPlace, it's because they have looked into it and have found something really positive about us.
The goal with the BirthPlace is to create a safe birthing atmosphere for women. And safe not just in the medical sense of safe, but safe emotionally.
You guys out of here? Congratulations!
It was wonderful. It was way better than I expected. It felt good to have a staff that was just so welcoming and so inviting.